So we're obviously contracted to deliver around the safeguarding and welfare requirements. So just quickly to recap what the EYFS is about. So children learn best when they are healthy, safe and secure, when their individual needs are met, and when they have positive relationships with adults caring for them. The safeguarding and welfare requirements specified in this section are designed to help providers create high quality settings which are welcoming, safe and stimulating, and where children are able to enjoy learning and grow in confidence. Michelle, can we move on to 3.4, please? So 3.4, this is the First Amendment. So providers must be alert to any issues of concern in the child's life at home or elsewhere. Providers must have and implement a policy and procedure to safeguard children. These should be in line with the guidance and procedures of the relevant local safeguarding partners. So the amendment here is that it used to be the local Safeguarding Children's Board. It's now been replaced by the local safeguarding partners, and that's to bring it into line with every other region. So you will see it now referred to as the LSP. It previously was the Bristol Children's Safeguarding Board, then changed to the local Children's Safeguarding Board, and it's now changed to the local safeguarding partners. And that also allows for the fact that the local authority will also have some input to relevant policies and procedures that you need to be aware of in terms of safeguarding. So that aligns and covers all of that. And there's also an extra bit which has been added in, which is to safeguard children and practitioners online. Providers will find it helpful to refer to the safeguarding children and protecting professionals in early year settings online safety considerations. And that's footnote 13, which you can see highlighted. If you haven't looked at that, if you would like to look at that, obviously, after this session, then it gives you tips about protecting your staff and children online, because that's now a requirement of the EYFS that you have due regard to safeguarding both your staff and children online. This was changed in 2017, so possibly you're already doing that, but it was not. It was changed in 2019, but was not included in the EYFS, so it's now been put into the EYFS policy. Michelle, can we move on, please? So we're now going to look at suitable people. So providers must, point 3.9, providers must ensure that people looking after children are suitable to fulfil the requirements of their roles. Providers must have effective systems in place to ensure that practitioners and any other person who may have regular contact with children, including those living or working on the premises, are suitable. So that's just to clarify that any person who comes into regular contact with children must be suitable. I think previously it was likely, the word in there was likely, but now it's who may have regular contact. Then moving on to 3.10, although this is about childminders, there's a reference to childcare on domestic premises. So with childminders, anyone who lives on the premises, as you'll be aware, needs to be checked on a DBS. Now, there has been some confusion in the past about where providers have lived over the premises on non-domestic premises, sorry, making a bit of a mouthful of this, about whether they needed to be checked. Just to clarify, if the provider is living over the premises, we know that there are some in Bristol, unless there is no access to part of the premises, then they don't need to be checked. So where the premises access is separate, because we know that some of them have flats which have separate entrances separate to the childcare provider, then there is no requirement for those people to be DBS checked. Can we move on, please? But there is still a requirement that providers 3.1, sorry, Michelle, you've gone past it, 3.1, Providers must tell staff that they are expected to disclose any convictions, cautions, court orders, reprimands and warnings that may affect their suitability to work with children, whether received before or during their employment at the setting. Providers must not allow people whose suitability has not been checked, including through a criminal records check, which is footnote 26, to have unsupervised contact with children being cared for. So that's just to clarify that you do need to, it's still a requirement that staff need to disclose to you if they have any convictions. And if that is the case, then they're not allowed to have unsupervised contact. And that's for you to risk assess and make a decision on whether they're still suitable to work with children. Footnote 26. 3.14. Just moving on to disqualification. A provider or childcare worker may be disqualified from registration. In the event of disqualification of a provider, the provider must not continue as an early years provider, nor be directly concerned in the management of such provision. Where a person is disqualified, the provider must not employ that person in connection with the early years provision. So although disqualification by association is gone, we just wanted to point out that childcare workers and obviously owners of childcare can still be disqualified. So you need to have regard to that. And it's a question that you need to be asking your staff on a regular basis. Is there anything that's happened either obviously in their private life or in previous jobs that might disqualify them from working with children? So you still need have an obligation to be asking staff that, and that regulation falls under the Childcare Act. So that's footnote 28. Also, there's a point about if you employ somebody and you haven't got their DBS check back, you still can have them working within your setting, but you just need to make sure that they're not left unsupervised. So if you're employing somebody and their DBS check hasn't come through, you still can have them working, but you need to make sure that they're never left unsupervised and never left on their own with children. But it's just to clarify that they can start work with you without the DBS check. Can we move on, Michelle? That's about disqualification. Sorry, Michelle, can we move on? So staff taking medications or other substances. So point 3.19, staff members must not be under the influence of alcohol or any other substances which may affect their ability to care for children. If a staff member is taking medication which may affect their ability to care for children, the staff member should seek medical advice. Providers must ensure that staff members only work directly with children if medical advice confirms that the medication is unlikely to impair that staff member's ability to look after children properly. The only change in that is it now talks about staff members as opposed to childcare practitioners. So it's to make it consistent throughout the document. And also in terms of your teams within your settings, it's not, a lot of you employ office staff, administrators, etc. So that then applies to all of your staff teams. So any staff members who may be taking any medication or the evidence of alcohol, the same thing applies to all of them. Right, I'm just going to pass you on now to my colleague Michelle, who's going to talk about staff qualifications.
Thank you, Julie. So as Julie said, we're moving on to staff qualifications, training, support and skills. So we are on page 26 of the document. So the first change here is at the very beginning of this section, and a new paragraph has been added. So this is now paragraph 3.20, and the new paragraph is highlighted in yellow here and says providers must follow their legal responsibilities under the Equality Act 2010, including the fair and equal treatment of practitioners regardless of age, disability, gender reassignment, marriage and civil partnership, pregnancy and maternity, race, religion or belief, sex and sexual orientation. So this has been added to make clear that providers must comply with the Equality Act 2010 to ensure the fair and equal treatment of practitioners of different gender, race and sexual orientation, etc. It also signposts you to the Act itself and reflects the importance of ensuring or striving for a diverse early years workforce which better reflects wider society. This is the only change on page 26. So there's no changes to the requirements around staff supervision or paediatric first aid. And there's no changes on page 27. So there's no changes to the requirements around staff having sufficient understanding and use of English, and no changes to the key person section either. So that all remains the same. There are, however, some changes on page 28. If you look at the first paragraph, so that's paragraph 3.28, which is about staff qualifications, the first phrase has been amended from in group settings to settings on the early years register. And this is to be clear that this requirement only applies to early years settings on the early years register and does not apply to schools. Also in this section, in this same paragraph, and also at the bottom of this page, and on pages 29 and 30, the phrase full and relevant in respect to qualifications has changed to approved qualifications. So from September, you'll need to make sure that qualifications are full and relevant, are approved, as opposed to being full and relevant. The reason for this change is because the phrase full and relevant applied when the Children's Workforce Development Council, which is the CWDC, were responsible for qualifications and their criteria. The CWDC has now closed, and so this wording is out of date. Instead, qualifications must be approved by the DFE. A footnote to go with this has also been added at the bottom of the page, so I'll just scroll down to that. And that's footnote number 33. So if you need to check whether someone's qualification is approved and so will count in your qualification ratio, you need to go to this link here, which takes you to the Government Qualifications Finder, and this is where you can look it up. So this will take you to a number of lists. There are actually sort of several lists. There's lists for qualifications that were taken before September 2014 and qualifications that were taken after September 2014. So I'm just going to go to that list now and show you what that looks like. So if you come on here, so if you click on the link, it will take you to this government page here where it says check early years qualifications. So the first thing to look at is the contents page down here. So there's all sorts of things you can check on here. You can check overseas qualifications, or you can't actually check the qualifications, but there'll be some information about overseas qualifications. There's information about paediatric first aid, degree level qualifications, and I'm just going to click on one of these here. So we'll click on qualifications started after 1st of September 2014. That will take you to the relevant section here, and then I'll show you where the actual list is. So if you click on search our full list, that then takes you to another page with another load of documents. So basically you need to know the date of the qualification, and then you can click on the right document. The documents for pre the 1st of September 2014 and after the 1st of September 2014 will look slightly different, and they're laid out slightly different. If we just go on to this one, so qualifications from September 2014, it brings up the list at the bottom of the page, and that will take you to a table. So for these ones that are post September 2014, anything on this list will be approved. Okay. Whereas if we go to one which is pre-September 2014, it's just slightly different. So I'll just show you the difference here. So if we click on it, it just brings up a slightly different table. So that's just some information there. So you need to click on the tab down here where the actual qualifications are. It's just laid out slightly differently. So this is a list of all the qualifications and then you have to scroll across. And because this is an older document, they're still using the, I can't seem to click it across, they're still using the term full and relevant. So that's the sort of crucial column to look at in this. So you find the qualification you're looking up, and then you come to this column here, is it full and relevant? And it will either say yes or no. So there we go. So I'll go back to the document we were looking at here. So you need to know the exact name of the course. You'll need to know the awarding body, and you'll also need to know the date that the course was taken to be able to find it on the list. Okay, so I'm going to scroll back up here. Oh, sorry, I'll go back to footnotes. So there are a couple more new footnotes that have been added at the bottom of the page. Footnote 35 is new and states that these qualifications requirements do not apply to out-of-school provision for reception-age children. So it's up to out-of-school providers to decide for themselves what qualification staff should have, and this is again stated in the separate paragraph for before and after-school care and holiday provision, which is in paragraph 3.41. The other new footnote is footnote 36. Now that refers to the sentence further up in paragraph 3.28 that says the provider must ensure there is a named deputy who in their judgment is capable and qualified to take charge in the manager's absence. So the footnote to go with that then says capable and qualified includes having necessary skills and knowledge to deputise. A deputy does not have to have any specific qualification. So this is to make it clear that deputies are not required to have specific qualifications to take on the role of deputy, and that it is for providers to use their judgment to determine their capability. Scroll back up now. So if we now look at paragraph 3.29, the words including whilst eating has been added to the first sentence so that it reads, providers must ensure that children are adequately supervised, including whilst eating, and decide how to deploy staff to ensure children's needs are met. So this makes it clear that supervision of children does include whilst they are eating. So you do need to ensure that ratios are maintained at both snack and meal times. So the reason for making it clearer is because the supervision of children whilst eating is important to help prevent choking and to detect signs of choking so that rapid action can be taken if and when needed. Then if we move down to paragraph 3.30, this now includes a reference to being suitable. So suitable is a new word that they've added in, and the amendment is to clarify that 17-year-olds and students must be suitable, which means they must have an enhanced criminal records check before being left unsupervised. And the reason for the change is just to clarify the existing EYFS policy and to ensure that different people do interpret it in the same way. Okay, so if we move down to 3.31, a sentence has been added to this paragraph. And so this paragraph now states that exceptionally, and where the quality of care and safety and security of children is maintained, changes to the ratios may be made. The new sentence that has been added comes after this and says, this applies to all settings, but childminders cannot have more than 6 children under the age of 8 per adult providing care. So adding this new sentence makes it clearer that for all providers, exceptions to ratios may be made in exceptional circumstances where the quality of care and safety of children can still be maintained. Again, that just clarifies the existing EYFS policy, which some providers reported that they did need more clarity on. Okay, so the changes to the next 2 pages are just the changes to the wording around qualifications and the use of the new term approved. And also in paragraphs 3.35 to 3.38, the current reference to or another suitable level 6 qualification has been changed to or another approved level 6 qualification. That's just to clarify that that refers to another level 6 qualification that has been approved by the DfE and not one that hasn't been approved. So if we now move on to page 31, paragraph 3.39. So this has had a footnote added, footnote 48. It refers to ratios and qualifications for reception classes and states that in an academy, a teacher can have whatever qualification the trust regards as appropriate to teach in an infant class in line with admissions law. And so that's just, that update is just to align with existing admissions law and make clear what the position for academies is. And moving down to 3.41, so we're on the paragraph about before and after school care and holiday provision. So a footnote has been added here, so footnote 49. So I'll that. And so that's just been added to clarify the type of providers that this applies to. And it just sort of defines what a school is. So it says that school means maintained school, non-maintained schools, independent schools and academies. The requirements in the actual paragraph haven't changed. And then the next couple of paragraphs there are just for childminders. And again, they just make it clearer that childminders must not exceed 6 children under the age of 8 per adult. And that's it for that section. So I'm going to hand over now to Elizabeth.
Thank you, Michelle. Okay, so moving on to health now, page 32, paragraph 3.45. Oral health has been added to the requirements to promote children's health. Improving oral health of children is a Public Health England main concern, and they have an ambition that every child grow up free of tooth decay to help give them the best start in life. So why has oral health been added as a explicit requirement? In England, tooth decay is the most common oral disease affecting children and young people in England, yet it is largely preventable. And whilst oral health is improving in England, tooth decay remains the #1 reason for childhood hospital admissions among young children. Tooth decay can cause problems with eating, sleeping, communication and socialising, and statistics show that children of school age miss around 60,000 days of school for hospital extractions. Tooth decay is almost entirely preventable, and oral health is part of the general health and well-being and contributes to the development of a healthy child. So how can providers promote oral health in their settings? Well, earlier settings have an important role in embedding the importance of good oral health with families. One way is to give information to families, for example, information leaflets displayed and posters about the dangers of sugary drinks and good oral hygiene. And settings can also build oral health into their curriculum through activities and games. Some settings also incorporate toothbrushing into their daily routine. And moving down now to page 33, paragraphs 3.46 and 3.47 and footnote 55 have been amended to further clarify that non-prescription medicines do not need a GP prescription before providers can administer them. The reason for this change is because GPs have expressed that parents and carers are needed to get prescriptions for minor conditions causing unnecessary GP appointments. Non-prescription medicines can include those that can be purchased from pharmacies, including some over-the-counter medicines which can be purchased from a pharmacy, and also health shops and supermarkets. A link to the British Medicine Association has been added to footnote 55, which gives further information on this change. Providers must make sure that non-prescription medicines are suitable to give to children. Also on page 33, paragraph 3.48, additional wording has been added to clarify that fresh drinking water must be available and accessible to children at all times. By having water available and accessible for children at all times, providers are encouraging children to drink fluids regularly, stay hydrated, which is really important as children may not remember to have a drink by themselves. Depending on the age of the children, you could have a self-service water station, or you could provide individual water bottles for children. Moving down to paragraph 3.49 and footnote 56, they have been added to ensure providers are aware of where to go for further guidance on the safe preparation of food in earlier settings. And in footnote 56, you are signposted for example menus and guidance developed by the government, which we're going to have a look at now. So here are the example menus and recipes that the government have developed for earlier settings to use within their provision, and it gives examples of seasonal menus. So for example, here we've got a weekly planner for different menus. So there are a series of example menus and guidance relating to the different ages of children aged between 6 months and 4 years, and includes information on breakfast, lunch, tea, and snack. And just moving down, we'll have a look at one of the recipes. So here's an example recipe, and it gives you information on the ingredients, the quantity, and also the method for the recipe as well. So it's a really useful resource, and we do really recommend that providers use this. I can certainly go back over the medicine part of the section at the end if you like. Okay, so moving down, there have been no changes to accident or injury within this new reform. On page 34, Managing Children's Behaviour, paragraph 3.53, the first sentence has been made a standalone paragraph. The remaining sentence has been incorporated into paragraph 3.53 as they are both about corporal punishment. The reason for this change is to separate the requirements on corporal punishment from general behaviour management, and it's intended to add some clarity. Each setting needs to have and follow a behaviour policy, and this should set out the expectations for everyone's behaviour in the setting, including the adults and staff. It should outline the strategies that will be used to guide children's behaviour. It's worth noting here that within settings, there's been a shift away from managing children's behaviour to promoting positive behaviour and helping children to develop positive behaviours that will support them in their learning and development. And I will go over the medicine at the end of the session.
Thanks, Elizabeth. Evelyn here now, and we're on to page 35, Safety and Suitability of Premises, Environment and Equipment. There's no change to the initial safety section, but moving down to smoking and now vaping. So that's a new addition on 3.57. So staff should not vape or use e-cigarettes when children are present, and providers should consider Public Health England advice on their use in public places and workplaces. The previous version of the EYFS did not include explicit guidance on vaping or e-cigarettes, and this addition is to signpost providers to guidance. And this will be in footnote number 58, and it provides information on vaping mainly as a tool to support adults to stop smoking. If your setting supplies a smoking area outdoors, a separate non-visible vaping area should also be provided. But it's not recommended that adults working with 18s vape or smoke in view of children. So moving down, oh yes, here we are already, onto premises. And again, there's addition to 3.58, and the addition is where an indoor activity in a building or buildings forms the main part or is integral to the provision. So the space requirements, which haven't changed, apply where the indoor is the main part of the setting, and the provision. But if we scroll down further on 3.58, they have added where space standards are applied, providers cannot increase the number of children enrolled because they additionally use an outside area. So if you're registered mainly as an indoor provision, you cannot take more child places because you have an outdoor space. So forest and other exclusively or almost exclusively outdoor provision is not required to meet space standards as long as the children's needs are met. For these kind of provision, indoor space requirement can be used as a guide for the minimum area needed. So that really emphasises that although the space requirements are different for outdoor provision like forest school, those outdoor provisions need to meet all the other safeguarding or welfare requirements that meet regard to premises, and such as hygiene, toilet requirements. All those arrangements have to be put in place, but on an outdoor basis. Okay. So then we move down to paragraph section 3.60, and it's about sleeping children. And they've added the words, additional words at the beginning of the paragraph, and linked to guidance on safety checks for sleeping children. So sleeping children must be frequently checked to ensure that they're safe. Being safe includes ensuring that cots and beddings are in good condition and suited to the age of the child, and that infants are placed down to sleep safely in line with the latest government safety guidance. So if you scroll down a little bit, you can show the links. That's right. So that's links 60 and 61. So the first one is the NH advice on sudden infant death syndrome, and 61 is NHS advice on safety and sleeping. So this signposts existing guidance, and includes advice like always placing the baby on their back to sleep, always placing the baby in a feet to foot position, keeping the baby's head uncovered, not letting the baby get too hot or too cold, using a mattress that's firm, flat, waterproof and good condition, and ensuring that there's no bedding or overhanging materials where a baby could get tangled. Okay. Move down to page 37. There's no changes here to risk assessment, outings or special educational needs. So swiftly on to page 38, information and records. Okay, so here there are changes. In paragraph 3.69, they've added footnotes 65. And this links to, this is guidance on sharing information on relevant services when there are safeguarding concerns. So on that is, if you could scroll, just show the footnote, that'd be lovely. So that's information sharing advice for safeguarding practitioners at government publications. That includes things like the 7 golden rules for information sharing. And this signposts providers to helpful guidance and aligns EYFS with advice given to schools. And just to clarify that relevant personal information can be shared lawfully if it's to keep a child or an individual at risk, say from neglect, physical, emotional or mental harm, or if it's to protect their physical, mental or emotional well-being. And as ever, you have to be mindful how you share information. So make sure you don't use things like unsecured email if it's sensitive information that you are sharing. So can we go back up to 3.70? That's lovely. Thank you. Okay, so here is the removal of a requirement for providers to get permission from Ofsted to store records off-site. And there's an updated footnote on data protection regulations in point 67. So it's an outdated requirement and clarify that data protection of records is a provider responsibility. So the footnote's been added to refer to current data protection legislation that's been updated since EYFS in 2017. They've also added a footnote 66, providing a link to the National Cybersecurity Centre, which has provided published helpful guidance on cybersecurity. And again, this is guidance being published since the EYFS in 2017. And I would say that, you know, as a lot of information is now kept electronically, this needs to be secured as your old lock cupboard. You've got, and this provides advice such as backing up your information, using passwords, protecting your systems against viruses and malware, and how to deal with suspicious messages. So we move down, information child, there's no change. On page 39, information parent carers, no change. Complaints, no change. And information about the provider, no change. Or the changes that must be notified to Ofsted or the relevant child boundary agency. But we move down to page 41, and there is a new additional paragraph called Other Legal Duties. So they've added a paragraph explaining that the EYFS sits alongside other legal requirements that providers are required to meet. And these cover things such as employment law, anti-discriminatory legislation, health and safety legislation, data collection, regulations, and the duty of care. And I think this is really useful for new providers who may read the EYFS and think if they cover, if they do everything in the EYFS, they've covered all their legal obligations. That is not the case. There are other legal obligations that providers need to meet as well. And I expect you long-standing providers are well aware of that. But for new people coming into the sector, it's really very useful to have that clarified. So move down to page 42. And this is just a clarification on the requirements, the criteria for effective paediatric first aid training. In paragraph 5, the emergency paediatric first aid was previously required to be face-to-face and still is, and would last for a minimum of 6 hours and cover the listed emergency skills. And that's in the point 5, and that is still the case. But also they've added in point 6 that that the emergency skills in the full paediatric first aid course, that's a 12-hour course, but the emergency skills part of that, which is listed in paragraph 5, should be delivered face-to-face. And the footnote at the bottom of that page, footnote 71, face-to-face means that trainers are physically present with their trainees. This excludes the use of online platforms. That makes that really clear. Obviously, the 6-hour course, the short course is useful whenever you've got newly qualified staff, and you can only count them in the ratio once they've had either the short course emergency first aid or a full paediatric first aid, which is, I think, the main way that most of childcare providers actually use the emergency first aid course. We are now going to stop recording